Greetings and welcome to this session of the Public Health Surveillance course, where we'll focus on evaluating public health surveillance systems. But first, before we jump into the session content, I wanted to say a few words about the reaction papers. You all submitted your first reaction papers this past week, and I was very excited to read them, and I thought that you all did a great job on summarizing the readings and identifying themes and some key questions. I just wanted to give some general feedback about a few things and provide some tips that I think could be helpful for future reaction papers that you submit in the course. So first, be sure to cover all the readings in your paper for a given week, not just a subset of them. And you should cite all of these readings using a reference management software in your actual narrative, not only at the end as a bibliography, so within the whole document. Most of you did that, but some of you did not. And also, please try to avoid summarizing each reading individually. I mean, sometimes you have to do a little bit of summary in order to make your point, but what I don't want to see is like one paragraph per paper. The key to a good reaction paper is to identify and write about some of the themes that you see across all of the readings, and importantly, relate them to the larger course content and concepts. So in the case of last week's reaction paper, which was focused on surveys and surveillance for behaviors and risk factors, one theme might be that the traditional surveillance systems that we've been talking about, such as those for notifiable diseases or vital registration and things like that, they don't necessarily capture some of the information on behaviors and risk factors that are important for public health surveillance to capture, especially for some health conditions and risk factors. And then, this is where the articles come in. Many of you did a great job in your reaction papers talking about some of the design issues and some of the inherent challenges as it relates to getting representative estimates of behaviors and risk factors that are often self-reported and might otherwise be very difficult to measure. So try to contextualize or maybe start your paper with where the readings fit into the larger arc of the course and the content that we're covering. And you can ask and then try to answer some of the questions that came up for you when completing the readings. And this kind of content in your reaction paper can also be helpful for your discussion board posts. I think that's it for the reaction papers, and I want to thank everyone for the great first submissions, and I look forward to reading the next round of your papers. Next up is grades. Grades for the reaction paper and your homeworks have been submitted or returned to you, but we did notice that there have been some glitches in Blackboard. So please notify us or let us know if any of your grades are missing up until now. Next, I wanted to cover a couple of issues related to the midterm exam and what to expect. The midterm exam will be made available in the next session after this one, and it'll be available from 12 a.m. on October 23rd to 11:59 p.m. on Sunday, October 29th. It's an open book style exam, a take-home exam, and you're not allowed to consult anyone on completing the exam, however, and there are going to be instructions about this that you'll need to adhere to. Once you start the exam, you'll have 2 hours to complete it. To avoid glitches, please be sure to update your browser to the latest version before you begin the exam. Chrome or Firefox will work best with Blackboard. Safari will also work, but please note that Microsoft Edge or Microsoft Explorer are not recommended. Importantly, there's also going to be an article that you'll need to read before you start the exam so that you'll be prepared to answer questions about it during the exam. We don't want you to waste any of the 2-hour time slot for the exam to read this article, so we're setting it up so that you can read it in advance of starting the exam. There'll be a link to the article on Blackboard, and the recommendation for you is that you download the article, read it, make any notes that you might need before you actually click through on the link that starts the 2-hour timed exam. The midterm exam will cover information from sessions 1 through 8 being this session. And finally, be sure to review the instructions that will be in the folder for the midterm exam on Blackboard before you start. I want to highlight too that this session's content, session 8, which is focused on evaluating public health surveillance systems, the readings, the content, and the related exercise that we're asking you to complete are on your own, are very relevant to the midterm exam. And about that surveillance system exercise, as part of this week's session, there's an exercise that you should complete on your own or with other classmates that takes you through the process of evaluating a surveillance system. You'll use what you've learned and any questions that come up as part of the process of completing that exercise as the basis for your discussion board post this week. So you should, obviously you're here listening to the lecture, so hopefully you haven't started the exercise. It's meant to be done after you complete the lecture and the readings. So here's the scenario that you're given, and also some other information that will be on the document in Blackboard. You've just been hired by a health department to work in the communicable disease program, and you've been assigned to work with the epidemiologist on the surveillance system for salmonellosis, a disease that is often associated with foodborne outbreaks. Salmonellosis is a reportable disease in your health department's jurisdiction, and both providers and laboratories are required to report all new diagnoses and isolates. While the system is passive, during possible outbreaks, the health department staff may send out notifications or alerts to providers and laboratories, reminding them of the importance of reporting cases. All cases reported to the health department are then interviewed by a public health epidemiologist to ascertain symptoms, date of symptom onset, and potential exposures that are relevant, such as food that they may have consumed, sources of food, and the case's occupation. The current stated objective for the surveillance system is to prevent and control salmonella-associated foodborne outbreaks. So your first task in this new job is to conduct a formal evaluation of the salmonella surveillance system. The document that you'll get will walk you through the process of this evaluation, and it'll be on Blackboard. And a few days later, towards the end of the week, an answer key will appear on Blackboard. But the idea is for you to first do it on your own and then use the content experience from completing the exercise to create this week's discussion board post related to evaluating surveillance systems. You don't need to hand in the exercise, but be sure that your discussion board posts relate to the exercise. And finally, completing this exercise will be useful to you as you prepare for the midterm exam, which, as you know, will be coming in the next session. So in this week's session, we'll cover the rationale and give you some guidelines for evaluating public health surveillance systems. And this is a topic that you're now much more prepared to engage with, since we've covered many of the principles and concepts of public health surveillance. Formally evaluating surveillance systems is a really useful process to engage with if you're working with a surveillance system for the first time, or if you're just reassessing a surveillance system that you've been working with for quite a while. This can help evaluate the extent to which it's serving its purpose and achieving its goals, and if there are any changes that should be considered. There are detailed evaluation guidelines for this process that CDC has published in the MMWR, and that's one of your readings that for this session, and it also is what I've used as the basis for the lecture. The goals and objectives of a surveillance system, a public health landscape, and the surveillance systems themselves can all evolve with time. And for this reason, it's useful and important to engage in the periodic formal evaluations of surveillance systems. Doing so allows the identification of ways to increase the efficiency, the quality, and the usefulness of surveillance systems as it relates to their achievement of goals and objectives. And as you saw in your readings, there are some very detailed guidelines for the process of evaluating public health surveillance systems, and we'll be going through these in detail in the session. Beginning with the process of engaging stakeholders to identify evaluation-related questions, describing the surveillance system, including some details around the health importance, its legal mandates, the purpose and operations of the surveillance system, and the resources required to operate the system and maintain it. Also, some considerations around focusing the design of the evaluation, gathering credible evidence on the system's performance, which could involve which could involve describing the level of usefulness of the surveillance system and going attribute by attribute through the list of surveillance system attributes that we've covered in the course. All evaluation of surveillance systems should justify and state the conclusions of the evaluation work, which in turn sets the stage for making recommendations about how surveillance systems should change or improve or evolve as a result of that evaluation. And finally, it's important not just to make the recommendations and state the conclusion and submit a report to your boss, for example, but also to take steps to ensure the use of the evaluation findings and to share the lessons learned so those involved in running or supporting the surveillance system can begin to take some of those recommendations and put them into action, ultimately making the surveillance system more useful going forward. So we'll briefly talk about and give examples of each of these, starting with engaging stakeholders. So all surveillance systems have stakeholders, people who have some interest in the operation, use, and utility of the surveillance system. We can define surveillance system stakeholders as any person or organization that might find the information from the surveillance system useful for their own work or for the purposes of health promotion. And stakeholders can include, in addition to the health department, other government agencies such as the Department of Education or community-based organizations, healthcare providers, community representatives, elected officials, and so on. And it includes those who do the data collection, as well as those who contribute to the operation of the system, but also those people who are the consumers of the information that the surveillance system generates. The main reasons to engage stakeholders and to do it early on in the evaluation process is to help identify the most appropriate evaluation questions and to help ensure that the evaluation findings will be useful not just to you or to the health department, but to the broader group of stakeholders in the surveillance system. It's actually a lot of work to undertake a formal evaluation of a surveillance system. So this step of engaging stakeholders and identifying the most appropriate and useful evaluation questions is really an important one. Next, you'll want to spend some time describing the surveillance system as it is in its current form. And that includes some of the related things listed here that may have changed since the surveillance system was established. These include the health importance of the disease or the condition or the health-related event that's under surveillance, the legal mandates for surveillance, the purpose, goals, and operations of the system, and the resources required to run it. We've talked about different ways of describing the health importance or quantifying the burden of disease of a condition under surveillance, and also how these things can change over time. And here's a slide showing the leading causes of death for New York City. So one way to begin to describe the health importance of the condition under surveillance is to reflect it in terms of where it stands in the cause of death rankings for the jurisdiction, or the numbers of deaths, or the death rates. But there are also other methods of quantifying the burden of disease that may be important for a condition under surveillance that, for example, doesn't cause a lot of deaths in terms of its ranking. Like it might not be in the top 5 or top 10 causes of death, but it still might have high public health importance because it, for example, primarily affects young people. And the example here is showing, for HIV infection. So the other methods to quantify the burden of disease or the health importance might be useful in these situations, such as years of life lost. It helps capture information not just on the number of deaths, but it also reflects the fact that deaths tend to occur at earlier ages for the condition. And this is a slide from the Global Burden of Disease Project showing a visualization about years of life lost for different diseases. For health departments, it's important to consider those conditions with substantial years of life lost burden that are also preventable or for which there are other interventions that exist to reduce the public health burden. And this is why there's a big focus of health departments in many jurisdictions on reducing overdose deaths, suicides, and road injuries, to name a few important causes of YLLs that might be trending in the wrong direction, or that may be preventable, or for which there are interventions that can help reduce the burden. The New York City Health Department has used the Take Care New York plan to outline a number of areas for health priorities, and many of which relate to conditions that are high burden that can be reduced through public health action. And if there's a plan like this in the jurisdiction where you're working, it can be important or helpful to talk about where the surveillance system you're evaluating fits into this plan. Or if it doesn't, you can say why you're still considering it as a potentially important surveillance system for an outcome of health importance. So it helps if you can couch the health importance of the surveillance system in the larger landscape of priorities that the health department or the jurisdiction have stated. If it doesn't fit into the larger priorities, that's okay. It could still be a really interesting way to frame the evaluation work. There are other examples of conditions that have high health importance, even though the burden of disease isn't high per se. Let's go through the example of measles. This slide shows the numbers of reported measles cases going back to well before when the vaccine became available in 1963. And the blue lines show vaccine coverage, or the proportion of people in the population that are vaccinated against measles. The US eventually got to a place in the late 90s where there were very few cases of measles in a given year. But does that mean we no longer need a surveillance system for measles? This is an example of how the health importance of a condition isn't only reflected by the number of cases. Its health importance lies in the fact that it's a serious illness that is preventable. Indeed, since there's been so much success with prevention of measles, people tend not to worry about it as a health threat anymore. But a big part of public health's agenda and priorities is to keep vaccine preventable diseases at bay. That in turn means keeping vaccination levels high, as well as detecting and responding to outbreaks quickly when they occur. And of course, for outbreak detection, you need surveillance. So even when public health is doing a good job at keeping the burden of a serious condition low, sometimes you still need surveillance. And the justification of that surveillance system is really to monitor the condition and keep the burden low through routine public health measures like vaccination programs. As you can see on the inset of the chart here, there's been a resurgence of measles with successively larger outbreaks through 2019. And this trend was disrupted by the COVID-19 pandemic, but we've since learned that vaccination coverage among children for most childhood vaccines has dropped, primarily because of vaccine hesitancy and misinformation, in addition to the disruptions of the pandemic. Many public health systems, at least those for notifiable conditions, have a legal mandate and related regulations that serve as a basis for authorizing health departments to conduct surveillance for that condition. So as part of your description of the surveillance system in an evaluation, it's important to revisit the legal mandate. What is the legal or regulatory basis for the surveillance system? What are the laws and regulations that support its establishment? They may or may not exist, and if they don't exist, what then is the basis for the surveillance system? And also, how is the surveillance system funded and who funds it? With regard to legal mandates, we'll be having an entire session after the midterm that's devoted to the legal basis for surveillance systems. The slide from earlier in the course should look familiar to you. Central to the evaluation of any surveillance system is to review and describe the system's objectives. So here are some objectives. They may or may not be explicitly stated for the surveillance system that you might be working with, or if they are, they may also not be relevant anymore. Or the objectives may be different depending on who you ask. For example, different stakeholders or other people involved in the surveillance system. But as part of the surveillance system evaluation, it's important to try and establish the objectives as best as possible, the current stated objectives or the perceived objectives, and maybe even the aspirational objectives according to different sources. And it may be that objectives of the surveillance system are something that need to be reconsidered or reassessed or need to change. So it's helpful to talk to people about what they see as the objectives of the surveillance system. It actually can get interesting when people say different things. If you're lucky, although this isn't always the case, you might even find written objectives of the surveillance system somewhere that can serve as a jumping off point. And of course, some of the things you might hear as people talk about the objectives of the surveillance system are listed here in this list of common objectives of surveillance systems. The list can be useful for you to refer to as a guide for the conversations you have with people about the surveillance system's objectives. We've covered a lot about the operational issues related to running surveillance systems in prior lectures and readings. So when it comes time to characterize the operations of a surveillance system, you know some of the key things to be thinking about. What are the case definitions? Is the case definition practical? Does it need to change? What's the population under surveillance? What kind of information is collected as part of routine surveillance? What are the data sources of the reporting systems and who's expected to report? And then what happens after that? How are the data handled? How is confidentiality maintained? And how are the data analyzed and disseminated? When the surveillance system data are disseminated, does it get to all those who need to know, including the medical and public health communities and policymakers and other stakeholders in the surveillance system? These are the kinds of things to characterize as the operations of the surveillance system in the evaluation process. Characterizing the operations of a surveillance system is where you get into a lot of the nuts and bolts of things. What are the procedures? You're going to want to get copies of all of the forms and get into some of the details that are really necessary to understand how the surveillance system operates on a day-to-day basis. Going back to the legal mandates, you'll want to get a copy of the regulations and laws that establish the surveillance system or serve as its basis. You're also going to want to get copies of any dissemination reports that go out. For example, does the surveillance system issue annual, semi-annual, or quarterly reports? Are they issued on time, with regularity? You may even find that the surveillance system hasn't disseminated any data in quite a while. And this kind of digging is what you really need to do to understand how the surveillance system actually operates so that it can be described accurately in an evaluation. And when characterizing the operations of a surveillance system, it's helpful to create a visual or a flow chart, beginning with the occurrence of the event under surveillance and then all the way to the point of disseminating some of the information. It's useful for the team that's formally evaluating the surveillance system, but also as you're talking to other people who are involved, to continue to build and add detail around your understanding of how the surveillance system works and all of its components. It also becomes something that can be used to show people and confirm that there's at least a shared understanding as far as the key aspects of the surveillance system operations are concerned. And you've seen these types of flowcharts before. This is actually a flowchart that I created in the process of evaluating the surveillance system for HIV/AIDS in New York City. And this level of detail is really what you need to help get into the details when you're going through this process. And here's another example of a flow chart for surveillance system operations that we saw last week. Part of the resources required to run the surveillance systems relate to costs, and this includes the direct costs of the surveillance system, which are usually mostly personnel, but also some financial resources that are expended to maintain the entire breadth of the system, starting from data collection all the way to dissemination. And it's also useful to assess costs against the system's objectives and usefulness and against the expected cost of possible modifications or alternatives to the surveillance system. You can quantify this in different ways, including the overall cost of the system or the cost per case detected or the cost per case treated in the community. And you'll recognize this slide from a prior lecture as well. It really reflects a cost analysis of different scenarios and different ways of running a surveillance system. It compares the cost of running an active surveillance for hepatitis versus a passive one. Once you've done some of this background work and gathering some of the information and you begin to understand and document how the surveillance system works in its current state, you can begin to think about what the design of your evaluation might look like, including how it will address some of the key evaluation questions that you've identified. This stage is where it becomes important to be very clear about the questions that your evaluation will be designed to answer. What are the key important evaluation questions that you've identified through background work comes into play? For example, it could be things like, what's the positive predictive value of the surveillance system for outbreaks? Is the system efficient? Can the system be more timely? Is the system acceptable? Is the system useful? So what designs then are capable of answering these questions or capable of providing insights as it relates to some of these questions? Who will receive the findings and recommendations of your report? What will be done with that information? And what are the metrics and standards that you'll be using for assessing the surveillance system's performance in these realms? And once you have your questions and the design, you can move on to the phase of gathering credible evidence on the system's performance. Here you can describe things like the usefulness of the surveillance system, and you can go through a series of surveillance system the series of surveillance system attributes that we've covered in prior sessions. Related to usefulness, does the surveillance system actually make a difference in public health practice? Here around usefulness, you can ask questions like, what actions have been taken to date as a result of information from the surveillance system? What information has been disseminated from the surveillance system? Who's used that information to make decisions and take action? What other future uses might the information from the surveillance system have? The usefulness of the surveillance system is influenced greatly by its operations, including the feedback mechanisms to those who need to know, but also by the system's attributes. And finally, is the surveillance system underutilized? If it's not currently useful, might there be potential for the system to be useful? It may be that it's not reaching its potential for some reason that you could potentially identify. And then the question becomes, to what extent are there improvements that can be made to make the system more useful? So other questions you can ask when assessing the usefulness of a surveillance system include, can it detect events in a timely enough manner to permit prevention? Can it estimate the magnitude of the public health problem and identify risk factors? Can it monitor trends over time reliably? Does it stimulate research that leads to disease prevention and control? Does it permit assessment of the impact of prevention and control measures? And does it lead to improved clinical, social policy, and practice outcomes? Here's an example that I think demonstrates one useful aspect of New York City's HIV/AIDS surveillance system. The map is showing the number of people who inject drugs who are also diagnosed and living with HIV by zip code. The more red areas of the map show those areas of the city where there are greater numbers of people with HIV with a history of injecting drugs. And the yellow dots overlay the map, show where syringe exchange programs are that help prevent transmission of things like HIV and hepatitis. So this is what I would call a classic gaps analysis. You can quickly see the areas where the locations of needle exchange programs line up well with the larger number of people with HIV who may inject drugs. But you can also quickly see that there are lots of areas on the map that have high numbers of people with HIV who inject drugs, but where there's no needle exchange program nearby at all. So this map was used by the health department and our commissioner at the time to advocate for the strategic placement of new syringe exchange programs where there was demonstrated unmet need in the name of helping to better control HIV spread in the city. I think it's a great example of how a surveillance system like the HIV surveillance system has demonstrated its usefulness. So when evaluating a surveillance system, you want to try to find examples like this that you can point to. As part of evaluating the performance of the surveillance system, it's also important to go attribute by attribute through this list that we've covered in prior sessions, describing or even collecting qualitative or quantitative information that can help characterize the surveillance system along these lines. The evaluation should really have something to say and ideally some data to show for each of these attributes. At the end of the evaluation, you'll have gathered a lot of evidence, anecdotes, and perspectives, and you'll be in a position to draw conclusions and justify them based on what flows from the data and evidence about the surveillance system that was gathered and analyzed. This positioned This positions those that are completing the evaluation of the surveillance system to make recommendations that are directly supported by the data and evidence that were compiled. So the conclusions drawn from the evaluation should relate to the present state of the system and not going too far back in time, especially if the surveillance system has substantially changed or evolved. The conclusion should speak to whether or not the system is addressing an important public health problem. The conclusion should support recommendations for how to improve the surveillance system, including how it might be possible to improve efficiency and quality. Also keep in mind that any recommendations you might make for improving a particular attribute often means that there will be a trade-off with another attribute. For example, if you increase sensitivity, you might lose specificity or positive predictive value. Improving some of these attributes often comes at the expense of others. And finally, your recommendations should focus on the areas that will help enhance the ability of the system to achieve its objectives. You can make lots of recommendations about how the surveillance system could be better, but the goal here is to focus more squarely on those recommendations that will strengthen the system's ability to achieve its core objectives. As part of the evaluation, you'll often identify the limitations of the surveillance systems, and here are some of the common limitations that we've discussed and should look familiar to you. Underreporting of the event of interest or incomplete reporting, a lack of representativeness of the cases in the surveillance system relative to the cases that are occurring in the entire jurisdiction or to some other target population under surveillance, lack of timeliness or inadequate timeliness, an inconsistency of case definitions or how a single case definition may be applied inconsistently in different settings across the jurisdiction, incomplete or inaccurate information on case reports. For example, you're expecting to get data on 15 different elements from providers when they report to you, but on average you usually get about 6 or 7 of them with each report. And lastly, the potential for bias in your surveillance system as it relates to what's going on in the larger jurisdiction that you're trying to monitor. So these limitations need to be considered alongside the surveillance system's objectives, and it's possible to have a surveillance system that's quite good at achieving its objectives, even though it also has limitations, including things like completeness of reporting or poor representativeness. In terms of recommendations, they often fall into a number of different categories. So here are some general recommendations that have been used to improve surveillance systems in the past. You may need to focus on improving the completeness of case reporting, and that can happen by giving more attention to the infrastructure that's used to file and process case reports. It can also be accomplished through increasing the awareness of providers and training providers on the process of reporting. That may also be needed. And it's almost always the case that you can improve completeness by simplifying the process of reporting. You can think about tapping into new data sources. For example, if a system has only relied on provider reporting, it may be that there are new laboratory tests or systems that you can begin to think about tapping into. And increasingly, there are electronic data sources that can be leveraged, such as electronic health records or laboratory databases. On the data use side, there's often improvements that can be made in terms of how the data are analyzed and processed. And there can be better use of existing information systems that health departments use to manage surveillance data. In terms of increasing the completeness or timeliness, while it would require more resources, it may help to transition a system that's fully passive to something that's closer to active or a hybrid of active and passive. And something that can often be greatly improved and make a lot of difference is to improve the feedback and dissemination processes to make them more systematic and useful. There's often work that can be done to better ensure that dissemination includes the kind of information that surveillance system stakeholders are looking for and that they find useful about the surveillance systems. Of course, this isn't going to come without a need for more resources or reprogramming of resources, and so it's just something to keep in mind. Lastly, after all the work of researching the surveillance system and understanding how it functions from the ground up, from the inside and out, and collecting data and translating that data into information and evidence that supports conclusions and recommendations, It's important to ensure that the stakeholders are aware of the findings and recommendations that flow from the evaluation. It can also help if you have consulted some of the stakeholders for input as the recommendations were being formulated. So by disseminating your findings and increasing the awareness about lessons learned, it will help increase the chances that those recommendations will be taken up and actually result in some positive change to improve the surveillance system to help it be more effective or more efficient at achieving its goals and objectives. So this is a good time to go back to those stakeholders that you met with initially to get a sense of their perspectives on the usefulness of the surveillance system. It's a good time to go back to them and report back and let them know what you found and make time to talk to them about some of your conclusions, about what you think are some of the key recommendations to improve the surveillance system and how they might be implemented. This often requires a lot of follow-up, but is really worth doing. There's also different audiences with different interests in the surveillance system, so you need to remember to tailor the findings and recommendations to each audience as you present them. Some of the recommendations might be targeted towards providers, and some of them might be targeted towards internal health department staff who are working closely on the surveillance system from day to day. But be sure to frame evaluation-based recommendations in terms of the gains and trade-offs so that people can make an informed decision about whether and how to implement or not implement specific recommendations. Lastly, it's always good to have a written report of the evaluation that you've done, and you can take it further. It's also a good strategy to give oral presentations or publish journal articles and peer-reviewed publications as a way of sharing lessons learned beyond the jurisdiction where the evaluation took place. Other jurisdictions almost always find this kind of work very useful, and it'll save them a lot of time and maybe even spur them on to do similar evaluations of their own surveillance systems, or they may just act directly on the recommendations that you've already formulated. As an example, back in 1999, we set up a surveillance system in the middle of an outbreak for West Nile virus that was trying to identify those cases of West Nile virus that resulted in hospitalization. Afterwards, we did an evaluation of how the surveillance system performed, part of which is shown here. During the outbreak, using our case definition for reporting viral meningitis and encephalitis cases, we identified 719 potential cases of West Nile virus over the course of a few months through provider reporting and active surveillance. All of those individuals were then tested for West Nile virus. And this gave us an opportunity to look at different aspects of our case definition to see where we were getting more or less yield. And what we concluded was that focusing more on encephalitis cases rather than meningitis cases would result in a much higher hit rate. And also in the lower part of the table, we concluded that focusing on younger persons that met our case definition didn't really yield that many cases, but focusing on older persons did. So this helped us refine the case definition for future surveillance for West Nile virus to make it more efficient. And it also helped other jurisdictions who needed to set up surveillance systems for West Nile virus gave them an easier time and some insights about how best to do it more efficiently. So it's an example of how you can disseminate conclusions and recommendations based on an evaluation that might be useful to you going forward as well as other jurisdictions. So a couple of concluding remarks and pro tips. If you're beginning to work with a new surveillance system, say it's your next job and you're working on a surveillance system that you're not familiar with yet, it's a good idea to ask if there have been any prior evaluations of the surveillance system. And if they're available, be sure to review them. This is one of the fastest ways that you can learn about a surveillance system, how it works, and what its limitations are. And if your health department doesn't have a prior evaluation, you can always look for formal evaluations of similar systems that have been done in other jurisdictions or maybe by the CDC. If a new evaluation of a surveillance system that you're working with isn't available, you can offer to conduct one since it may be useful to the organization. Or you conduct your own evaluation as part of the process for getting yourself oriented to the system. It doesn't have to be a full-blown one, but going through some of these guidelines just for your own purposes can really be instructive and help you really get up to speed about how the surveillance system works and to do a better job leveraging it. And lastly, many of the principles and guidelines outlined in this session are relevant beyond surveillance systems, including the myriad other public health systems that you might encounter in your careers. So that's it for this session. I hope you guys have a great week.